Calcium in pediatrics resuscitation. What are the specific situations where calcium is recommended for use in CPR? A. Hypertension and tachycardia. B. Hyperglycemia and hypokalemia. C. Hypocalcemia, hyperkalemia, hypermagnesemia, and calcium channel blocker overdose. D. Hypoxia and acidosis. C. Hypocalcemia, hyperkalemia, hypermagnesemia, and
These
calcium channel
restrictions are
blocker
based on the
overdose.
possibility that exogenously administered calcium may worsen ischemia/reperfusion injury.
What is the role of calcium in myocardial excitation contraction coupling? A. Decreasing ventricular contractility. B. Inhibiting ventricular automaticity during asystole. C. Enhancing ventricular contractility. D. Regulating blood flow in the brain. C. Enhancing ventricular contractility.
The calcium ion is essential in myocardial excitation contraction coupling, in increasing ventricular contractility, and in enhancing ventricular automaticity during asystole.
What can severe ionized hypocalcemia lead to in adults experiencing out-of-hospital cardiac arrest? A. Increased ventricular performance. B. Enhanced response to catecholamines. C. Decreased ventricular performance. D. Improved hemodynamic response to sepsis. C. Decreased ventricular performance.
Ionized hypocalcemia is associated with decreased ventricular performance and peripheral blunting of the hemodynamic response to catecholamines.
How does ionized hypocalcemia occur after blood transfusion? A. Binding of calcium to preservatives in blood products. B. Renal failure leading to calcium depletion. C. Bicarbonate administration during transfusion. D. Increased intracellular to extracellular calcium ratio. A. Binding of calcium to preservatives in blood products.
Ionized hypocalcemia occurs after massive or rapid transfusion of blood products, a result of citrate and other preservatives in stored blood products binding calcium.
What is the recommended pediatric dose of calcium chloride for resuscitation? A 10 mg/kg. B 20 mg/kg. C 30 mg/kg. D 40 mg/kg. B 20 mg/kg.
The pediatric dose of calcium chloride for resuscitation is 20 mg/kg. Calcium gluconate is as effective as calcium chloride in raising ionized calcium concentration during CPR. Calcium gluconate is given at a dose of 60 mg/kg, with a maximum dose of 3 grams in pediatric patients.
How should calcium be administered during CPR? A. Rapidly through a small bore intravenous line. B. Slowly through a large bore intravenous line. C. Subcutaneously for faster absorption. D. Orally for convenience. B. Slowly through a large bore intravenous line.
Calcium should be given slowly through a large bore, free-flowing intravenous line, preferably a central venous line.
What did the study by Srinivasan et al. Find regarding calcium administration during CPR in pediatric patients? A. Improves survival to discharge and favorable neurologic outcomes. B. No significant difference in outcomes compared to no calcium administration. C. Decreased survival to discharge and unfavorable neurologic outcomes. D. Increased survival but no impact on neurologic outcomes. C. Decreased survival to discharge and unfavorable neurologic outcomes.
They found that 21% of patients survived to hospital discharge when calcium was used, compared with 44% who survived when calcium was not used. Only 15% of patients had a favorable neurologic outcome when calcium was used, compared with 35% with a favorable outcome when calcium was not administered.